Hey, good afternoon, everybody. We're back to do another positioning video, and today we're going to do the chest x-ray. And it's probably the most widely done x-ray anywhere you go, and here too. We do a lot of chest x-rays, especially during this time of year. So the projections that we're going to concentrate on in the urgent care are a PA, upright PA, and an upright lateral, a left lateral. We don't do very many specialized chest views here anyway. They are done, but not here, so we're not going to concentrate on them. SID, source to image distance, is 72 inches, and the reason we do 72, not 40, is that the chest lays on the anterior of your right in front of your spine, and we want that as close to the image receptor as we can. And we're going to reduce the magnification from the OID by using 72 inches. Okay. Central ray for the PA and the lateral is at T7. And I'll show you a little trick how to do that. And it's also the inferior angle of the scapula. Okay. Collimation wise, we want 1.5 to 2 inches above the shoulders. And we want to get below the 12th rib on the inferior side. Laterally, just both skin margins, as well on the lateral, the anterior and posterior skin margins. Okay, and we'll show you that as well. Technique, we're going to use a high KVP technique because we're looking at soft tissue, so we want a lot of shades of gray. So the PA, we're looking at 110 to 120 KVP, 2.5 to 5 mass, depending on the size of the patient. Lateral, 110 to 120 kVp, 5 to 10 mass, depending on the size of the patient. Okay, breathing techniques are very important with chest x-ray. We need to take a really deep breath in so we can inflate the lungs, so we can see the lung tissue well. And also, we can see several structures properly if we have a good breath hold. So, respiratory is very important. Okay, we need to pay close attention to not have any rotation. If you have rotation on a chest x-ray one way or the other, it can show your heart bigger than it actually is. And a couple other structures may look a little bit out of whack if we are rotated too much. Okay, so let's just go over here to Kate. By the way, we got Kate and Mikkel here again. So we're going to do a PA chest. I would have Kate take off her jacket as well as her necklace and any bra straps or anything like that. It's just easier if a woman takes off the bra. We'll get history. We'll also find out if she's pregnant or anything like that. We'll deal with that before we take the x-ray. Okay, so we're going to have the patient's chest up against the board. Okay, now, like I said before, we're going to have 1.5 to 2 inches of light above the shoulders. Okay, so we can see that right there. Our central ray is going to go right down her spine, so mid-sagittal plane right there. Now T7, we've got a big prominence right here on the back of the neck. If you take your hand, put the thumb there, and extend your finger down, where your finger or your pinky finger lands, that's going to be approximately T7, okay, or the inferior angle of the scapula. So thumb on the prominence of C7, finger down. So this is going to be our central ray point, and I will just move that up a little bit. But anyway, we've got 1.5 inches up here. We're going to have the patient roll their shoulders forward, okay? We want to move those scapulas out of the way so we can see lung tissue instead of scapula, right? So a central ray goes right down her back right here, okay? And we can go over here, we can see light on the lateral, and we've also got light on this lateral, so we know we're going to get everything we need to get. And if we're open to 17 inches, we're going to get the bottom of the lung, unless the guy's a 6'10" guy, and then you may have to take another picture. But we're going to be good. All right, we got the shoulders rolled forward. Okay, we're going to have Kate take in a big breath and blow it all the way out, and take in another deep breath and hold it, and at that point you will expose. Okay, We've got our left marker up here on the left side, so we know that this is the left side, okay? So that is the PA, pretty simple. This time we're gonna do the lateral. So like I said, we're gonna do a left lateral. And the reason we do that is that heart is on the left side, and we want the heart as close to the image receptor as we can, okay? So we're gonna have Kate bring her arms up in the air. I will usually have them rested on their head, but make sure they roll their elbows in anterior, okay? We want the side right up against the image receptor right here, okay? We don't want a bunch of space right there. So we'll have Kate as close to that image receptor as we can. Now, I will usually take the patient at the waist, and we want them to be perpendicular to the image receptor. Okay, so we want a 90-degree right angle right here. We don't want them out here like this or inside like that. So when we get our picture exposed, we're going to have our posterior ribs stacked on top of each other. Okay, and that's what you're looking for. Okay, and you can tell whether that's perpendicular or not. Central array wise, again, we're going to be at T7. Okay, we've got 1.5 inches of light behind the back. We also have light at the front, okay? And we've got light above the shoulders as well, okay? Again, we're gonna do the second inspiration breathing technique. So we'll have Kate take a deep breath in and blow it all the way out. Another deep breath in, and we'll shoot the image, okay? So that is a chest x-ray. We're gonna do a PA and a lateral. Make sure you're doing a left lateral. Make sure you're doing it 72 inches, very important. Collimate as tight as you can, but make sure you don't cut any costophrenic angles off or the apices of the lung, okay? Anyway, piece of cake, okay? I talked about something that's very important in the chest x-ray, and it has to do with breathing. So that's the first question today, is what kind of breathing technique do we use for a chest x-ray, for both PA and lateral? And what side of the body is the heart on? Unless you have situs inversus or something, and then it's totally opposite. Anyway, thanks for coming today. We'll do an abdomen here shortly and get it put on as well. And have a good day. See ya.